Welcome to Knowledge on the Go, where we explore the best practices that have emerged in Vizient's PI collaboratives. I'm Kellie Goodson, Performance Improvement Program Director at Vizient. In this episode, we'll discuss emerging practices identified from a health system that participated in Vizient's Social Determinants of Health benchmarking study.
Cottage Health is located in Santa Barbara, California. We are a 3-hospital system, including Santa Barbara Cottage Hospital, which was founded actually by a group of 50 women nearly 130 years ago in response to the growing needs of the community.
Kathryn Bazylewicz from Cottage Health is Vice President of Marketing and Population Health, which is an unusual title.
I sometimes get the question, well, that's kind of an odd combination, marketing and population health. But if you really think of the core of marketing, where you do market research, you segment the population, you put in the programs or initiatives, you track the results, and then you continuously make improvements on that, it's exactly what we're doing with population health at Cottage Health.
That makes a lot of sense, but not many organizations have a centralized effort toward population health. Cottage Health's unique organizational structure has helped them emerge as a leader of this important work. Nestled between Los Angeles and the San Francisco Bay Area, most of us wouldn't think of Santa Barbara as a town with great social needs. We think stars.
Right. But in actuality, there is poverty in Santa Barbara as well. Our county is 46% Hispanic Latinx, with 12% of our overall population living below the poverty level. And across the state of California, our county, Santa Barbara County, has the highest percentage of homeless students and the third highest percentage of families in poverty.
Faced with the facts about their city's health disparities and issues with homelessness and poverty, Cottage Health's leadership took action.
Our work in population health really started with a vision of our president and CEO, Ron Werft, and then the leadership and support of our board of directors. And to show that support, in 2015, we actually changed our mission statement to include the words, improve the health of our communities, and then launched our new organizational focus on population health. Since that time, we've launched a lot of different initiatives within what is now called the Cottage Center for Population Health, which works to improve the health and wellness, focusing on equity for the most vulnerable in our hospitals and the community. So it was really a shift in working outside the walls of our hospital.
Working outside the walls of the hospital requires deep knowledge of the community, and to gain this information, they took a close look at its needs.
We started with a community health needs assessment and an environmental scan to understand the needs and opportunities that exist in the community to address the health and well-being of the residents. In doing so, we recognize that there's a lot of community organizations already doing great work to address these needs.
Conducting a community health needs assessment helps hospitals connect with partners in their community. Monica Ray is Cottage Health's Population Health Strategic Development Manager, and she loves the numbers.
We provided an intensive data collection process that was based on the CDC's Behavioral Risk Factor Surveillance System to conduct telephone surveys randomly across the county of community members. And in doing so, we've developed a robust data set that we've made publicly available on cottagedata2go.org. And that is available for community members and community organizations to help drive decision-making and help inform the approach that they take to addressing the needs of the community.
The Cottage Health team took their community health needs assessment to the next level with this data, well beyond what hospitals normally do as part of their required community assessment. They used their findings and their unique team structure to maximize their efforts.
We started with one evaluator, with Monica and with me, and then we really expanded. And now we have 2 evaluators, an epidemiologist, 2 community nurses that work specifically for the Center for Population Health. We have 8 part-time and full-time parish nurses that are out in our community. We have a social worker who's out working with individuals who are experiencing homelessness. We have a community health navigator. So we really have a great team that's working together to help improve the health and wellness of our community.
Once they had the quantitative data, they wanted qualitative data to get the whole picture. And that's when they started having conversations with their community.
I think what makes our community health needs assessment a little different from how other health systems conduct theirs was really our listening tours. Our listening tours we did internally and externally.
We spoke with about 230 to 250 community members and community leaders and pulled together an understanding of the health needs and opportunities that they see from their perspective in the community, and have used that data to guide our focus areas and the approach that we take within population health.
We sat down and talked about what makes a community healthy. And we had our CEO there, we had members from our population health team, and it was just a great conversation with our community, but also internally on what makes employees healthy and what makes our workforce healthy.
What they learned was eye-opening. Even Cottage Health employees were struggling with basic food and housing needs. Now it wasn't just about the community, it was about their own people, which got the attention of their senior executive team.
We spent a day in a room talking about how we should set this up and where should we start. And there was a strong message that we should start from within and start with our own employees, set this up, start small, and then expand out to our community.
But it is a sensitive subject and something that few employees want to share openly with their employer.
So we set up a program called Employee Resource Connect that partnered with our human resources team through our employee health and safety to screen all employees for those 4 basic needs: food, housing, transportation, and behavioral health. And we found that 25% of employees screened positive for one or more need, and food insecurity was the highest need. In response to this, we've developed a food program where employees who screen positive are offered a $50 food subsidy in the form of credit to our cafeteria or a grocery gift card or 3 produce boxes. A resource navigator from the Family Resource Center then works with those individuals to connect them to additional financial assistance and help them to identify long-term solutions.
Cottage Health found a way to maintain the dignity of their staff needing assistance, and their appreciation was shared with the population health team.
Because their confidentiality is maintained, we really hear that feedback from our partners, the Family Resource Center, and they're able to share with us how much employees really appreciate this, how they just needed assistance in connecting to some of these existing services. And then with the food program, that's a service that they wouldn't otherwise have access to if we hadn't been screening or if we hadn't been implementing this program. And that has been especially appreciated because it can address the food insecurity needs that individuals are experiencing right then and there.
To our knowledge, this is one of the first programs to address the social needs of employees as part of their population health work. In addition to implementing the social needs screening for their employee population, they also started implementing it with patients in the emergency department at their Goleta Valley Cottage Hospital.
In the first year alone, we screened more than 1,000 patients, 22% of which screened positive for one or more basic need, and 14% of which screened positive for food insecurity. We implemented a similar food insecurity program where patients who are coming into the emergency department are connected with a food subsidy and connected to long-term resources through the help of a navigator.
With this experience under their belt, they expanded their work to include additional screenings for other patient populations within their community.
We're serving as a convener to implement adverse childhood experience screenings and referrals in the pediatric clinic that addresses social determinants of health, and also looking at this as we work with those individuals experiencing homelessness.
And since Katie knows both population health and marketing, she knows how to spread the word about the great work that they're doing so everyone within Cottage Health who needs help knows how to get it.
We promoted this throughout our organization so people knew that we were doing this, and to encourage people to take the health screening. We got that same feedback from employees, just how proud they are to be part of Cottage Health and part of an organization that would put a program like this in place for its employees.
What started out as a community health needs assessment, focusing outside the walls of Cottage Health, ended up giving them an opportunity to help their own employees while also testing out programs that now impact their community.
When we started population health at Cottage, we made a commitment to improve the health of our communities through our core values of excellence, integrity, and compassion. And I really think this program that we've put in place that helps improve the wellness and the health of our employees and also of our community really illustrates how we've reached out beyond the walls of the hospital and into our community. And none of this would be possible without the vision of Cottage's leadership, without the support of our donors, and without the partnerships that we have with our community. And we're very grateful to everyone who's made this program a success.
Thanks to Kathryn Bazylewicz and Monica Ray from Cottage Health for sharing their unique story. And thanks to you for listening. Please join us for more knowledge on the go. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com. From Vizient's PI Collaboratives team, I'm Kellie Goodson. Remember, knowledge is transformational. Share it.